today to tell you that sometimes women think if their baby is okay during the first stage, they've been, fine, they've been happy with the baby's progress all through the 9 months, but at the final stage, they start to wonder, what if something goes wrong? How will we know? How will the nurses and doctors know? So let me tell you today that this is a priority for the nurses and the doctors when someone is having their baby, could be in the initial stages, somewhere in the middle of the first stage, or towards the end. So we have a couple of things that we are very careful about. The one thing that I want to talk about today is listening to the baby's heart rate. So during the first stage of labor, every 15 minutes, we listen to the baby's heart rate to ensure that it's in the normal range and there's no abnormality in the heart rate. Because an abnormality in the heart rate actually tells us that the baby is distressed and not getting proper oxygen. And then we can investigate later on, further on, to find out what's happening. And in case the heart rate remains low or goes very high, above the normal, then it's time to take action. So you might ask, what's the normal heart rate? The normal heart rate is technically anywhere between 120 beats per minute to 160 beats per minute. A little bit higher or a little bit lower is acceptable. But once it jumps to really low levels or really high levels, that's when the doctors and nurses know that there's something really wrong and they need to take remedial action. So how do we check the baby's heart rate? Like I said, every 15 minutes, if you're walking around and everything is good, we have this machine here that's called the Doppler. It's an ultrasound machine, and the nurse will just take out the Doptone transducer. She'll put some little jelly here and then place it on the mom's tummy where she can hear the baby's heart rate and count the number of beats she hears per minute. So if it's in the normal range, all is good. So every 15 minutes, the baby's heart rate is checked. Suppose with the Doptone, we hear some sort of variability or some sort of concern that we are really not happy about. Then we might use continuous monitoring, where we hook the woman up with the help of a transducer, which is plugged into the machine here. We hook the woman up, and so we get a continuous heartbeat of the baby. So how do we know that? We have this paper here, and with this paper, we get a tracing of the baby's heart rate. Of course, we might also monitor the uterine contractions, but the baby's heart rate is the significant what I want to say is of significance that we are keeping our eye on. So that's about the continuous monitoring and the intermittent monitoring. Now suppose your water breaks, then what happens? Right away, we want to check the color of the amniotic fluid. So is it a nice cream straw colored amniotic fluid, or is it dark brown or black? Dark brown or black water leaking out of your vagina tells us that the baby might be in distress. Of course, if that happens, the first thing the nurse would like to do is examine and see if the baby's cord has come in front of the head. Once she determines that that's not the case, then you might be hooked up to continuous electronic monitoring once again. And so generally everything is fine, and we have the pediatrician on board with us for the time of birth. So just in case there's a little bit more distress going on, the pediatrician is there to take care of your baby and ensure that baby is breathing really well after birth. So these are a couple of things. You might wonder that my baby doesn't move so much during birth or just before birth. I don't feel it moving. The reason is that baby is really squished at this last stage, and therefore there's not a lot of movement going on that you might feel, and that's okay. That's okay. There's nothing to worry about that. So after you've realized that we have these different ways of checking your baby, you understand that baby safety is a priority for the nursing and medical profession. Thank you.